Shall we start?
Yes, please start.
I am Dr Pranav Shah. I am head of the Orthopedic Trauma and Hip Replacement Department at Marengo CIMS Hospital. My colleague is Dr Mayank. He is a senior anesthetist and who helps us with all our cases. We have successfully done a 3D printed cage implantation for a hip replacement patient whose hip was unstable because of complications of surgery done in Nigeria. In a matter of 1 month with 2 surgeries, we have been able to remove her socket which was pressing on the main artery, and we have been able to implant a 3D printed cage to cover up for the bone defect, and after that with hip replacement the patient has been able to stand, walk and move around without pain. We are happy that we are discharging her today after almost a month of hospitalization in a painless and happy condition.
What are the benefits of a 3D printer?
The benefits of the 3D printed cage is that the void that is being created cannot be filled by any substitute other than the 3D printed cage. Previously we had the routine cages where the fitting was not perfect and they would loosen out over a period of 3 to 4 years. But the 3D printed cage is customized to the patient's defect, and so it holds very well, it is very stable, and it has a place for bone ingrowth so that the grip on the bone increases over a period of time.
In India, you are practicing with this practice of this cage 3D print for the Indian patients also?
Yes, any patient who has a bone defect after a failed hip replacement will benefit with this technology.
And what was the age of the patient?
The lady that we operated was 56 years old, 120 kg.
Oh, right. So,
See, can it be replicated in all patients or only for some patients?
No, this can be replicated for any patient 4 feet height to 6 feet, 7 feet height, because it is customized to the patient's bone. So the size of the cage will come according to the defect of the patient's bone. It is based on the CT scan of that patient.